Hey everybody, Leo Goitman here, and today I have a very special guest with me, Dr. Tom Mitchell. Dr. Tom Mitchell has a bachelor's in biology, human biology, doctor of chiropractic medicine. He is a certified chiropractic sports physician. He's a certified applied kinesiologist. He is also the founder of the Chicago Institute for Health and Wellness and the chairman for the American Academies of Sports Practitioners and the co-founder of the Sports Combine. Dr. Mitchell is the author of The Mitchell Principle, and I'm really excited to have you here. Dr. Mitchell, how are you doing today?
Doing fantastic. Thanks, Leo.
Tell us a little bit about why we're here and what we're going to talk about today for the viewers.
Well, you know, the goal of being here is to educate the patient and or educate the people behind the camera, the people that walk through the door of the office. My job as a physician, in Latin, it means to teach. As doctor means to teach. So somewhere along the lines, we've lost that, and doctors think that we're here to fix the person across from us, and that's not our goal. That's not even our job. Our job is to help them get better in real life, and to keep a healthy, sustainable lifestyle that gives them the ability to perform effectively, efficiently in real life.
Sure. Well, let me ask you, how do you go about teaching people how to live a healthy life?
Well, the first step to anything is to figure out what's going on with that individual, right? So when, let's say, a patient walks through the door, the first step is to comprehensively really take a look at them, listen, do a consult, listen to what they have going on, do a very intensive investigation or exam on that person, and then start to apply an approach that's specific to that individual using objective data. And it's hard to do. I mean, it's not something that's easy, and most people that go into doctors' offices, whether they're allopathic doctors like MDs or DOs or chiropractors, they feel like they're pushed through there. It's right. Get in and out, and we're just going to kind of do this, and I hope you feel better. But our goal is to not just get them feeling better. We want them to feel better. But the goal is to give them the resources, the tools, and teach them how to go out into real life and be a healthy person. And that applies to athletes also. Give them the tools for them to go out and perform at a very elite, efficient, functional level.
That's awesome. Dr. Mitchell, why don't you tell us a little bit about yourself and how did you get to this point in your life and in your career?
I've been practicing chiropractic medicine for the last 10 years. And in that 10 years, I've had the opportunity to work with some of the best physicians in my field, as well as physicians in the allopathic field, like MDs and DOs, and not just in sports medicine, but in functional medicine as well. And functional medicine, what's kind of neat about our office, what's kind of neat about what I do is nothing is the same. So I may see someone walk through the door with migraine, headaches, neck pain, back pain, sports injuries such as an ACL tear or a shoulder tear or something like that, a rotator cuff tear, and then the next person walking through the door may have digestive issues or may have an autoimmune disorder, and they're all there for the same purpose, and it's not actually to get better. They walk through the door thinking they're there to feel better, and they are, and then they walk out of the door understanding what it's like to live a healthier life and to be better, and that's our job, and that's my job. I'm also an athlete, and this is part of the book that I wrote. But my last record that I broke in bench press, I broke the American record in April of 2013, which is from this video a few months ago. And so I don't just tell you what to do. Right. I try to practice what I'm doing, and that actually helps them understand where they need to go next.
Absolutely, makes perfect sense. Let me ask you this. Can you give us an example of where the current model seems to break down and is even detrimental to the patients, in your opinion?
Well, you know, the model kind of breaks down in one specific main category, and that's everything is reactive. So people don't typically walk into, let's say, a chiropractor's office because they feel great and they just want to make sure that they're doing okay. They just hurt themselves. They went to pick something up, bang, their back goes out. They don't walk into an orthopedic surgeon's office before they blow their ACL. It's always afterwards. So everything is reactive. And what we try to do is we see injuries that have already occurred. There's no doubt about it. We see conditions that are already happening. That's why they walk through the door. But the goal is to get them on a path that leads to prevention of the next injury or the next condition, and you educate that person on what that looks like in terms of what are the concomitants or how things progress with the situation that they're currently in. So if you take a simple ankle sprain and say, okay, I sprained my ankle, 6 weeks later, I know what the tissue damage is, I know how it's going to heal, I know how long it takes to heal, I know the basic components of rehab. But why did they sprain their ankle in the first place? Did they have a weak ankle? Did they have abnormal foot function that led to this sprained ankle? Did they have abnormal spine function that led to this sprained ankle?
Right.
So when you find those things out, then it stops the next injury, or it helps bolster the ability for that person to go back on the field, on the court, or wherever, or back into real life without spraining that ankle again. And then everybody's heard of the person that keeps spraining the same ankle over
Right.
and over again, and you're probably one of them, because almost everybody's one of them.
Okay.
So what broke down to make that occur? And that's what we do best. You know, there's a basic acronym out there, and it's called RICE, and athletic trainers apply that all the time, and it's rest, ice, compression, elevation. So again, you sprain your ankle, you rest it, you stop running, number one, you put ice on it almost immediately, 15 minutes on, 45 minutes off, no heat, right? Because that's another shift. What do? Ice or heat? Nobody knows.
Right.
Well, it's not that hard actually to figure out. If you watch sports at all, the professional athletes that go out there, they put ice on them right away. So just treat your body like you're an athlete, and you make $5 million a year doing it, and you have it down. So then the next step is compression, which could be an ACE bandage, real light compression. You don't want to cut off circulation, and you get it elevated so that you can get inflammation out of the area. But it's not just about treating it as an injury. You have to know the difference between what's soreness and what's an injury or what's pain. So the goal is to educate the coaches, to educate the parents, to educate the kids, people in general, on the difference between the two, and when you need to go to a physician and when you can take care of it yourself.
You actually mentioned a book, and I know that you have written a book. Can you tell us a little bit about the book, and also why did you decide to write it right now?
The book that I wrote is called The Mitchell Principle, and basically what that is, it's a guide to elite performance, but it's also a guide to just a healthy lifestyle. So elite performance can be applied to an athlete, and it can be applied to sports medicine, it can be applied to the weekend warrior, but also those same principles can be applied to everyday people in their everyday life, let's say. The main components of just being an elite athlete, there are certain things and criteria that you see successful athletes go through, or categories that they fill to take themselves to the next level. And that can also be applied to the everyday person out there in terms of their health and their well-being. But the first one is coaching, right?
Okay.
You need proper coaching. Michael Jordan had a basketball coach. He was the best basketball player in the world. He still had a basketball coach. What we do in our office is something called health coaching. And that health coaching is to help people understand where they are, again, apply an approach using objective data, and then let themselves take themselves to the next level with our guidance, right? So coaching is number one. The next one is nutrition, and this is the most neglected component to, let's say, sports in general.
Okay.
There's a lot of marketing out there. There's a lot of pre and post workout this, and should you
Right.
drink Gatorade, and how much sugar's in that, or should you whatever it may be,
Okay.
right? But nobody really applies nutrition the way they need to apply it, from a recovery standpoint, from a priming standpoint. But in the book, what we talk about is a clear vision of how to apply nutrition for the athlete, but also how to apply it for the everyday person so that you're healthier. Simply that. Mm-hmm. We also talk about training and proper training. So I've coined a term called neurostabilization training, and that process, it's an idea. It's how you can apply it to any type of training out there. Mm-hmm. So it could be sports-specific training, it could be CrossFit training, it could be weight training or resistance training and power training. It doesn't matter, because when you apply the principle to what you're doing, what it does is it trains the brain. It trains the brain to work more effectively, more efficiently in the activity that you're doing. And so when the athlete or the person steps back onto the playing field or steps back to work, they're using their bodies correctly, and the motion there is effective, efficient, and it leads a lot to the prevention of injuries, as opposed to, again, the reactive care that we talked about. The next step is injury care. And again, we talked about that a little bit. What to do when you get injured. Is it ice? Is it heat? When to do ice? When to do heat? All those things. Those are all covered in the book. That's important, but basic information that everybody can apply, coaches, athletes, moms, dads, whatever. But the real key to the book, again, is prevention. You're going to hear that word over and over again because that's the goal. It's a whole lot easier to keep people out of trouble than to pull them out of trouble.